This video discusses various drug injections for different patients with varying conditions and medications. Our first case is a gentleman from Iraq. Given the usual habits in Arab countries, Arabic speakers generally prefer outpatient injections. Although we often administer injections to patients in a supine position, this gentleman insisted on having the injection administered while sitting up, and as you can see, we are giving him the injection while he is sitting. His medication is methylprednisolone, which is an anti-inflammatory drug used to reduce and eliminate inflammation in joints and bones, as well as allergies. Furthermore, physicians frequently use this drug for intra-articular, within the joint injections. The next case is a gentleman who was prescribed 2 ampules, Biotin Dexpanthenol, to strengthen his hair after surgery and hair transplantation. We administered a combined injection of biotin and dexpanthenol to this gentleman, and we asked him to provide us with an acceptable rating. It is worth noting that these 2 ampules can be mixed and injected together, or they can be injected separately. The next case is a gentleman who has a glucose saline solution, dextrose normal saline. Inside his IV bag, there is an ampule of Apotel, an ampule of Ketorolac, and an ampule of B-complex. He insisted that the vein puncture cannulation be done on the back of his hand and did not allow us to perform the cannulation from the inner forearm or the antecubital area. We cannulated the vein on the back of his hand, and there were no issues. The next case is a gentleman who is suffering from severe weakness, lethargy, and body aches due to travel. For him, we administered a strengthening and fever-reducing infusion, which is the Apotel ampule, along with an analgesic and an antibiotic. You can see that his veins are quite prominent and visible. We enter the vein with the proper positioning and perform the cannulation for him. However, if this patient remains in this position, his infusion will not flow at an appropriate speed because the patient should be completely lying down. The next case is a gentleman who complained of nausea, for whom an ondansetron or Domitron ampule was prescribed, which is both effective and reliable for nausea. The next case is another IV infusion, and as you can see, we are preparing his infusion. A scalp vein needle is inserted, and then the medications are added into the IV fluid. During this time, a gentleman approaches us who has 2 ampules. One is a hyoscine ampule, which is a painkiller used for abdominal pain, and the other is a cimetidine ampule, which is injected for gastrointestinal problems. As you can see, we prepare and proceed with the injection. This gentleman is in great pain and complains about the pain of the injection during the procedure. We have administered his next ampule as well, and we hope he achieves complete health. Goodbye until the next video.
چرا خدایا
خب
دو تا
آره یکم بچرخیم و یکم بچرخیم تمام بلند شو